Going to a doctor, let's face it, it isn't much fun, but imagine being so scared you actually faint. Medical phobias aren't that unusual. In fact, we all have it to some degree. But as Carrie Marsden found out, if it's bad enough, it could put your life at risk.
Not everyone likes a shot in the arm, but for some, it's a fear that can be consuming.
Whenever I get blood work taken, I always faint, no matter what.
Molly Fromer has been afraid of needles for as long as she can remember. When she was 8 months old, she suffered second and third degree burns and had to be hospitalized.
I had an IV when I was really young, and ever since then I've had a fear of hospitals, pain, and mostly needles.
14% of people have an extreme fear of blood and needles. 4 to 5% of those are considered a medical phobia.
So we're not talking about your kind of everyday average amount of fear or nervousness when you're going to the doctor or dentist. We're talking about something that gets to the point that it really interferes with someone's life.
Experts say that's when it becomes a problem because the phobia can prevent people from getting life-saving procedures.
So I remember one person that we saw who had a tumor, a pituitary tumor, who needed surgery, who couldn't even think about whether he could get the surgery. I've seen a number of people over the years who have wanted to get pregnant but were afraid of all the blood work that they'd need while they were pregnant, so they've put off getting pregnant. I've seen medical students who are going to drop out of school. It can have a real effect on people's lives.
Phobia is highly treatable. One of the most common treatments is cognitive behavioral therapy. Patients confront their fears in a gradual way.
That might be simply, having them see a needle, having them be in the same room with a needle, having me hold the needle, all the way up to, holding the needle themselves, and then eventually we'll go with them and actually have their blood drawn.
Fromer has never thought about counseling, but admits her fear is a phobia.
If I'm scared at that one time and don't actually go through with getting a needle or blood work, then I know that I'm delaying it, and I know that that's bad for my health.
Health officials say with treatment, it's reasonable to see a difference in anxiety levels within a couple months. Carrie Marsden, Global News.